Hello, welcome to our mental health mindfulness series. We are the University of Pittsburgh occupational therapy students. This video will be focusing on depression. My name is Marissa, and I will be talking to you today about suicidal ideation later on in the video.
My name is Jules, and I'll be talking to you guys today about postpartum depression.
My name is Colleen, and I will be starting off our video talking about clinical depression. Clinical depression is a mental health disorder characterized by persistently depressed mood or loss of interest in activities causing significant impairment in daily life. These are some of the significant risk factors for people with clinical depression. People with a family history of depressive disorders tend to be at increased risk of developing depression. Physical or medical changes such as a stroke, heart attack, or Parkinson's disease can increase the risk of depression. A stressful change in your life, such as moving, loss, or trauma, can increase your risk of depression. Having few or no supportive relationships can also increase the risk of depression in both men or women. Physiological factors such as perfectionism, sensitivity to loss, and being rejected can increase the risk of depression. Women experience depression twice as often as men. This can be due to changes in hormonal levels from pregnancy, menopause, premenopause, or miscarriage. Elderly are at a higher risk for depression, and sleep disorders such as insomnia are strongly correlated with depression. And now we're going to dive into the signs and symptoms of depression. Persistent sad, anxious, or empty moods, feelings of hopelessness or pessimism, irritability, feelings of guilt, worthlessness, or helplessness, loss of interest or pleasure in hobbies and activities, decreased energy or fatigue, moving slowly or talking more slowly, feeling restless or having trouble sitting still, difficulty concentrating, remembering, or making decisions, difficulty sleeping, early morning awakening or oversleeping, appetite and or weight changes, thoughts of death or suicide attempts, and having aches or pains, headaches, cramps, or digestive problems without a clear physical cause and or that does not ease even with treatment. And these are some important statistics to know about depression. Major depressive disorder affects approximately 17.3 million American adults, or about 7.1% of the US population age 18 and older in a given year. 1.9 million children ages 3 to 17 have diagnosed depression. The prevalence of adults with a major depressive episode is highest among individuals between 18 and 25. And as of 2017, 300 million people around the world have depression, according to the World Health Organization. And as you can see from these statistics, depression is very common in all populations all over the world. So now that we have discussed the warning signs and symptoms of depression, I want to introduce a basic depression questionnaire. The next few slides will consist of questions that are a part of a specific depression screen questionnaire. After I have read each question, feel free to pause the video to take some time and think about your answer. Do you have little interest or pleasure in doing things? Have you been feeling down, depressed, or hopeless? Do you have trouble falling or staying asleep or sleeping too much? Have you been feeling tired or having little energy? Do you have a poor appetite or are overeating? Have you been feeling bad about yourself or that you are a failure or have let yourself or your family down? Do you have trouble concentrating on things such as reading the newspaper or watching television? Do you have trouble moving or speaking so slowly that other people could have noticed? or the opposite, being so fidgety or restless that you have been moving around a lot or more than usual? Do you have thoughts that you would be better off dead or of hurting yourself in some way? Depending on how you answered the previous questions, you may be suffering from depression. If you think you may have depression, we recommend that you call your doctor and make an appointment to discuss your results. On the next slide, we will introduce different treatment options for depression. So the first treatment option is medications. Antidepressants are medications used to treat depression. If you are interested in this treatment method, please see a pharmacist or contact your doctor. There are several different types of psychotherapy, including talk therapy, cognitive behavioral therapy, problem-solving therapy, and interpersonal therapy. Brain stimulation therapy is an option some people choose to explore if no other treatments work. This requires several sessions a week to experience any results. Please see your doctor if you feel this is the right choice for you. There are also some things you can do throughout your day to help with depression. These things include staying active and exercising, setting realistic goals for yourself, spending time with trusted friends and family, letting others help you, and continuing to educate yourself about depression. And we will touch on a few of these therapeutic remedies in the next video of this series. There are local resources here in Pittsburgh that you can contact about your depression. UPMC Resolve has locations near Point Breeze, Homewood, and Wilkinsburg, PA. If you want to talk to a trained counselor, please call their telephone number. If you are not comfortable talking to anyone over the phone, you can also reach them through email at resolve@upmc.edu. You can also walk into any of their locations if you want to talk to a friend, a trained counselor about yourself, or even a friend or family member. The Allegheny County Warm Line provides peer support for individuals over the age of 18 with mental health challenges. The Warm and Friendly Call program can provide reassurance or reminder phone calls to anyone who is interested in signing up. And of course, there are also national resources you can also contact, such as the Substance Abuse and Mental Health Services Administration and the National Alliance on Mental Health Illness Helpline.
Next, we're going to talk about postpartum depression. So the definition of postpartum depression is having intense feelings of sadness, anxiety, or feeling unconnected to your baby after giving birth. And these feelings interfere with a new mother's ability to complete their daily activities. This occurs in about 1 in 9 new mothers. Some causes of postpartum depression are hormonal changes that occur during labor and birth, and these may trigger postpartum depression. There are also emotional changes that occur, and physical exhaustion from going through labor and giving birth can trigger this as well. And there are certain risk factors that make some new mothers more susceptible, which we're going to talk about on this next slide here. So the risk factors for postpartum depression are having a history of mental health issues, such as a personal history of depression, diagnosed bipolar disorder, postpartum depression following a previous pregnancy, having a family history of mood disorders or depression, recent life changes or stressful life events, such as losing a job or loss in a family, having an illness, or having complications during the pregnancy. And a support system. So not having a strong support system can be a risk factor for postpartum depression. Having an unplanned pregnancy or relationship issues with your significant other and financial burdens can also trigger postpartum depression. Some warning signs are restlessness, having mood swings and irritability, having a hard time bonding with your baby, feeling withdrawn from your friends and family, feelings that you aren't a good mother, sleeping too much or sleeping too little, and thoughts of self-harm or harming the baby. So the difference between baby blues and postpartum depression will be discussed on this slide here. So baby blues are typically feeling anxious, depressed, or angry in the days following giving birth, and this will usually resolve within 1 to 2 weeks after giving birth, and it resolves without treatment. But then postpartum depression is having more intense and lasting feelings of sadness and anxiousness, and these feelings interfere with completing your daily activities. The onset is typically 1 to 3 weeks to 1 year after giving birth, and it requires treatment to resolve. Postpartum psychosis is very rare, but it is very serious, and it usually develops within a week of giving birth and requires immediate medical attention. And it only occurs in about 4 out of every 1,000 new mothers. So the warning signs for this include hallucinations, paranoia, attempts to harm yourself or the baby, disorientation and confusion, and very rapid mood swings. So for example, you could go from uncontrollable crying to the next second hysterical laughing. Treatment for postpartum depression involves antidepressant drugs in combination with talk therapy. So some examples of talk therapy would be cognitive behavioral therapy, and this identifies the link between negative thoughts and emotions and how to develop positive patterns to reverse these negative emotions. Interpersonal therapy is about understanding how your mood affects your relationships. Dialectical behavior therapy is learning emotion regulation techniques so that you can manage your unpleasant emotions. And group therapy is also very beneficial because you meet with other mothers who are experiencing postpartum depression, and you can draw from each other's experiences to help find solutions for yourself. Some resources include the Allegheny Health Network Behavioral Health. So if you call this number here, they will help you set up an appointment and determine the best course of care. There is the Postpartum Support International, and this is the Western Pennsylvania division here. There's a phone number, or if you aren't comfortable talking on the phone, you can also email Catherine Biggs. And then, of course, if you feel like you are in immediate danger, if you're having symptoms of postpartum psychosis, it's important to call 911 or the suicide hotline.
Next, we will be talking about suicidal ideation. And there are a few different types of suicidal ideation. So there is suicidal ideation itself, which is wanting to take your own life or thinking about suicide. There is passive suicidal ideation, which occurs when you wish you were dead and that you could die, but with no plan of actually attempting suicide. And then there's active suicidal ideation, which is thinking about it and having the intent to attempt suicide, including having a plan on how to do it. There are many risk factors that can contribute to someone considering attempting or dying by suicide. They can't cause or predict a suicide attempt, but they are important to be aware of. These can include mental health disorders, such as mood disorders, schizophrenia, anxiety disorders, and certain personality disorders. Alcohol and other substance use disorders also have a large impact. A feeling of hopelessness, impulsive and or aggressive tendencies, a history of trauma or abuse, major physical illness such as traumatic brain injury, previous suicide attempts, family history of suicide, job or financial loss. And then lastly, lack of social support or sense of isolation. And there are different risk factors for children and teenagers more specifically. So having a mental health disorder such as depression causes an increased risk for suicidal ideation. loss or conflict with close friends or family members, history of physical or sexual abuse, problems with alcohol or drugs, physical or medical issues, such as becoming pregnant or having a sexually transmitted infection, being a victim of bullying, being uncertain of sexual orientation, and hearing of an account of suicide by a peer or family member. And lastly, medications with side effects of suicidal ideation. A young person may see some of these as more serious than an adult would, so they should be taken into consideration. And then we have some warning signs. So these can help you determine if you or a loved one are at risk for attempting suicide, especially if the behavior is new or the behavior has increased. Painful events, such as loss or significant change in one's life, may also increase the risk. Or if someone you know is experiencing these signs, call the lifeline provided later on in the video. So these warning signs can include talking about wanting to die or kill themselves, looking for a way to kill themselves, acting as if they are saying goodbye to people, talking about feeling hopeless or having no reason to live, talking about feeling trapped or in unbearable pain, talking about being a burden to others, increasing use of alcohol or drugs, acting anxious or agitated, and behaving recklessly, sleeping too much or not getting enough sleep, withdrawing and isolating themselves, showing rage or talking about seeking revenge, extreme mood swings, and giving away possessions. These are all things to look out for. Next, we have some suicidal ideation statistics that are very important. First, there is about 4.3% of adults 18 years and older have had thoughts about suicide, with the highest prevalence between adults ages 18 to 25. For those with mental health disorders, the rate is significantly higher than the general population. Suicide is the 10th leading cause of death in the United States and the second leading cause of death among those 10 to 34 years of age. So it is very significant. Women attempt suicide more often than men, but men are more successful 3 to 4 times more than women are. And next, we're going to be talking about treatment. So first, there is psychotherapy or talk therapy, where you work with a therapist to explore what you are feeling and why you are feeling it and how to cope with that. Then there is family therapy and education, which involves loved ones in the treatment and can help the individual better understand what they are going through. And then it can educate the family on the warning signs and can improve family dynamics as well. There is substance abuse treatment and lifestyle changes. These can help manage stress, improve sleep, eating healthy, increasing positive habits, and building a social network. And then there's medication, which this is usually not the first option for treatment, but it is a good option if you do talk to a doctor. Next, we have coping mechanisms. So identifying triggers is very important. You look for triggers or circumstances that may lead to you having feelings of despair, such as death or a loss of a loved one, substance use, or stress from relationships. Remember that feelings are temporary. They do come and go, even when it seems like it may be permanent. Take care of yourself. Eating healthy and regularly, staying hydrated, getting plenty of rest, and taking time to relax. And then building a community of support is also very important. Surrounding yourself with positive influences and giving back to the community always makes individuals feel better. And then getting active. This is always very good, increases the happy hormones in your brain. And then finding ways to relieve stress as well. And if you would like more information on how to relieve stress, you can look at our next video that we will be doing. And then we do have some resources for suicidal ideation as well. If you feel you or an individual you love are considering suicide and it is an emergency, please call 911 immediately. There is the National Suicide Prevention Lifeline, which is available 24 hours a day by phone or virtual chat, and the phone number is there for you. Then there is a crisis text line as well. You can text them if you do not feel comfortable having a conversation over the phone, and they're available 24/7. And then there is a veterans crisis line as well that you can text if you are a veteran that has been experiencing these symptoms. There's a substance use treatment referral hotline. If your loved one is looking into substance use treatment, feel free to give them a call and they can refer you to someone in your area. And lastly, there is a national sexual assault hotline, and the phone number is there below. Thank you for tuning into our first video. Keep an eye out for our second video of the series on how to maintain a positive outlook with mental health.